how are you doing?
Good.
My name's Rosalia Gonzalez. I'm a student nurse from Cedar Crest College, and I'm going to be working with you today. Is that okay?
That's great.
Can I have your name and date of birth before we start?
Sure. Harry Valentine, March 7th, 1968.
Okay. Can I have a seat here? Do you
Yeah.
mind? Okay. So, I saw your neighbor went out for a test. So I decided to come in and talk to you because I know he keeps the TV real loud, and I wanted you to be able to hear me. So I'm going to close the curtain just in case he comes back for privacy for us. Is that okay with you?
Yeah.
Okay. So I'm here for a teaching session. The doctor told me you're going to be discharged soon, and you're going home on 2 medications. One's called Metoprolol, and the other one is insulin Glargine. Okay. So do you have any cultural medications or barriers that will stop you from taking this medication?
No?
Okay, so I know that you didn't bring your glasses with you, so I bought this for you can be able to follow all the paperwork that I got for you. Have you ever been on any kind of Metoprolol before, or have you ever injected yourself?
No.
No knowledge of it.
No.
Okay, so my nursing diagnosis for you is that you're knowledge deficient related to a new medication, as evidenced by that you're telling me that you've never taken it and you don't know about it. So Metoprolol is anti-anginal and anti-hypertensive medication, and we also call it a beta blocker.
Mm-hmm.
If you get this medication in the pharmacy, you can get it as Metoprolol is the generic name, and Lopressa is the trade name. You can get either one. The doctor ordered 25 milligrams by mouth once daily. We prefer that you take it with food because it gives GI upset, and a full glass of water. So we put together some long-term goal for you. And so the long-term goal is that you maintain normal range of heart rate while you're at home, at least for 6 weeks until you come back and see the doctor. Okay? So we put together some short-term goals for you. And one of those short-term goals is that by the end of this session, I want you to verbalize at least 2 to 3 side effects of the medication. I also want you to tell me 2 to 3 adverse reactions of the medication. And then I also need you to verbalize that you understand how to take and how to inject yourself. Okay? Okay, so Metoprolol is a hypertension, it's used for hypertension, tachycardia, and people that have had a heart attack, and that's why you're here. And we want you to feel better. So, some of the side effects that the medication has is that it causes dizziness, it causes hypotension, hypoglycemia, it can cause depression, it can cause erectile dysfunction, and this medication, it comes with a perimeter. So the perimeter is that if you take your heart rate and it's 60 or less, you cannot take the medication. Okay? Have you ever taken your heart rate before?
No.
Okay, so I want to show you that.
Okay.
So can you put out your hand, please?
Sure.
So with 2 fingers, I want you to come down from the thumb, and you're going to find like a little groove. Push in a little, you're going to feel a pulse. And then you're going to count that for 60 seconds. Whatever you get at 60 seconds, that is your heart rate.
Okay.
So if it's under 60, what are you going to do?
I'm not going to take the medication.
Okay. So we're going to give you a prescription for a blood pressure monitor. That blood pressure monitor is electronic. You put it on your hand, you press a button, it's going to give you a number. The top is systolic, the bottom is the diastolic. And so if your systolic is less than 90, you don't take the medication. Okay? So this medication can cause hypotension. And so we worry with that because you're going to be home and we don't want you to fall. And so hypertension can make you dizzy and drowsy, and you can fall if you get up too quickly. So we want you to be careful when you get up that you take it slow. Another thing is that it causes hypoglycemia, and so with hypoglycemia, your blood sugars go down, and so we want you to monitor your blood sugars at home. Okay, and the medication, it also causes for you to get it can cause bronchospasms. So what that is that your airway gets constricted. It's like tightens and you can't breathe. You're like wheezing and gasping for air. You get chest pains, back pain. If that happens, that's an emergent situation. You need to call 911 with your doctor immediately and get to the hospital to be seen. Okay? And we worry with that because that's a contradiction with the medication, and you have an asthma. So we want to monitor that if it happens. You can't take the medication with alcohol. You can't take it with NSAIDs because it affects the way the medication works, and it can lower your heart rate. It can make you like dizzy. Okay. And any questions?
No.
Okay. So can you tell me 2 side effects that the medication gives?
Sure. GI upset and dizziness.
Okay. And an adverse reaction.
A low heart rate.
Yeah. And so, did you understand the medication and how you got to take it?
I did.
Okay. And so, one other thing I want to tell you is that the medication, the way it works, is that it decreases the workload in your heart, and it lowers your heart rate and it lowers your blood pressure, and it lowers the demand that your body needs of oxygen for it can work well. You know.
Okay.
So our outcome for you is that we prevent you from having another heart attack, and that the medication works at taking care of that. Okay?
That sounds great.
So I'm going to move on to the injection, if you don't mind.
No, not at all.
All right. So I have a paper here about the injection. I kind of made it bigger because I know you didn't have your glasses, and I wanted you to follow along.
Okay.
So when you take your injection, you're going to take insulin glargine. And so that is the generic name, and if you get it at the pharmacy, they might give you Lantus. That is the trade name, okay? The doctor ordered 10 units every day at 12 o'clock, okay? So you only take it once a day. So when you set up your table and you get ready to give yourself the medication, you got to make sure that you have your medicine. Take it out 30 minutes before you use it. That you have a syringe, and that you have swabs and the gloves, okay? So I'm going to give you that because I want you to work with me. Okay.
Put that aside.
So you got to clean your hands. It's very important that you clean it 20 seconds. And you can wash it with water and soap if you want. And then you put on your gloves. So what we do is I want you to open a swab, and you're going to grab the bottle and you're going to clean the top of it.
Okay.
And so you're going to take your needle and you're going to take your cap off. And so the needle, every line on this needle is 1 increment. Okay? So this needle is half a ml and the gauge is 31. And this is the barrel, and this is where your medication will go into.
All right.
So I want you to pull the plunger, which is the bottom part, down to 10, because that's what the doctor ordered.
Okay.
So you're going to take that, and you're going to put it inside the rubber, and you're going to hold it with your non-dominant hand, and you're going to push the air in.
Okay.
And so you're going to turn it around, invert it, and you're going to pull it back down to 10. If you see any bubbles, you tap on the thing. You can put the medicine back in and then bring it to 10 again so you can get the correct dose. Okay? All right. So then you pull it out. And you're going to do a scoop method. So you put it back in the cap because you don't want it to get contaminated.
Okay.
So then this is going to play as your skin. So This medication is given sub-Q. So what that means is that it goes into the fatty tissue of underneath the layer of your skin, the subcutaneous tissue. So we're gonna clean the area. You take the swab and you go in a circular motion. You don't gotta do it really hard. You just go in a circular motion and you let it air dry. Okay?
Okay.
So then you take the syringe out and we're gonna pinch the skin.
Okay.
And we're gonna put it at a 45 degree and we're gonna insert it and put the medicine in, let it go, wait 5 to 10 seconds, and then you pull it out and we're gonna put it in a recycled Sharpie. And so if you don't have one, you can make one on your own. You just put sharps on it, do not recycle. And if it gets full, you cover it and you tighten it with tape and you take it to a pharmacy or anywhere, hospital that disposes of them. Okay? You want to make sure that you don't use the same site all the time, and that if you have redness, bruising, or warmth, that you call the doctor after 4 days. And where you do it is that you can use your abdomen, or you can use the outer thighs or the outer arms. And we prefer the abdomen though because it's easier for you to do it yourself. Just make sure it's 2 inches from the umbilicus.
Okay.
Okay? Do you have any questions?
I don't.
All right, so I'm going to go. Thank you so much for your time.
Thank you.
And call the office if you have any questions.
Okay.
All right, thank you. Bye.